I can feel my pulse on the left side of my nose. Is this normal?
Yes, there is an artery there. If you press it just right, you can sometimes feel a pulse depending on the blood volume and pressure.
I can really feel it. It also looks a tiny bit swollen. I also have a sinus infection, so I have been blowing my nose a ton.
Sinus infections can cause the blood vessels in the area to dilate in order to bring in more white blood cells, for fighting the infection. This may be why you can feel the pulse now, whereas you may not have been able to feel it before.
Also want to ask, I have pretty bad anxiety, so just keep that in mind. I get a twitch under my left eye from time to time. Can this be anxiety? I also had a twitch in my right bicep yesterday, but think I slept on it. It gone now. Is this anything to worry about? And what is the best diet for the central nervous system? My aunt had ALS on my father's side, which makes me nervous. Do I have anything to worry about? I want to be as healthy neurological as possible.
Random twitching, or fasciculations, are very common among otherwise healthy young men and are almost always associated with health anxiety, poor sleep, fatigue, lack of exercise, too much caffeine, etc. The eyelids are a common location for this due to the fact that the muscles of the eyelids are constantly working. These fasciculations are almost always benign and self-limited, resolving after several weeks or months. Some changes in lifestyle are typically required.
Okay, good to know. I have been on a bad sleep schedule lately, so that makes sense. Thank you. What about the other questions?
There is no specific diet for the nervous system other than a balanced diet with not too much caffeine or stimulants such as Sudafed. Taking a multivitamin or B-complex vitamin may also be beneficial.
Can I also ask you a question that's pretty general but was very curious about? I try to not take too many antibiotics, but will of course take them if I need to. I have taken 3 antibiotics in the last year, and took a pretty fair amount when I was younger. How much antibiotics are too much? Thank you for your patience also, Dr. Bob. I really appreciate it.
No amount is too much if you truly need them. Resistance is rare, individually.
One final question, is there anything that I should avoid while I am currently on a Z-Pack?
No.
Okay, thank you, Dr. Bob. Blessings to you.
You're welcome.
Hey doctor, I wanted to ask you one last question. My doctor Wednesday thought there might be a chance I had a sinus infection, so gave me a Z-Pack. I haven't even been on it for 24 hours yet, and I'm not feeling too much better. Do I have to finish the antibiotic? And also, how can I tell difference between infection and sinus migraine? Taking the Z-Pack also have gas pains in stomach and chest. What can I do to help these symptoms? Last question, and if I were to experience side effects from the Z-Pack, would I have already experienced them by now? I have had the drug in me for almost 24 hours and started with 2 pills the first day. Thank you so much for your help and patience.
Some get a bit nauseated with drugs in this class. If mild, it should pass. It is a good all-purpose antibiotic and may be effective against sinus infections, but you would have to take the full course to get the full benefit. It stays in your system for 10 days or more, by the way, so don't be fooled by the short course.
If you have a health question and want to chat with a doctor now, visit justanswer.com/ythealth.